Docura is AI built to understand your documents. It runs locally, so information never leaves your computer. Workspaces ensure sensitive information is completely isolated. Here's how I'd use it as a speech therapist. This workspace is set up for one client. It contains client profile, initial assessment report, therapy goals, session notes, school communication, parent feedback, and structured intervention resources. I've indexed the workspace so it's searchable by the AI. Let's start with something practical. Tell me about my client. Your client's a 6-year-old child with a diagnosis of speech sound disorder. They've been attending weekly 45-minute therapy sessions for 9 months and have shown measurable progress in S production, achieving above 80% structured task accuracy. However, the R sound remains emerging with approximately 65% structured accuracy. The client's primary concerns include difficulty producing R and S sounds, reduced intelligibility in conversation, and frustration during peer interactions. The therapy goals set 9 months ago include producing R in initial word positions, producing S in isolation, improving conversational intelligibility. The client's been working on various exercises, including tongue placement cues for S, phrase-level practice, sentence-level structure practice, rapid production drill, and home practice exercises. The therapist is recommending continued targeted intervention to help the client achieve their goals. Are there any gaps in the current evaluation or intervention approaches that should be addressed before the next review? It appears the client's progress with the R sound has been slower compared to the S sound. The intervention strategies trialed have shown a strong response to visual cues, but there is still room for improvement in spontaneous speech generalization. One potential gap in the current evaluation or intervention approaches is the need to continue targeted intervention for the R sound. As stated in the NDIS plan review preparation notes, ongoing need for generalization of R into spontaneous speech suggests that more work may be required to help the client generalize their R production beyond structured tasks. Additionally, the school communication note recommends continuing therapy and reinforcing R practice during literacy sessions. This indicates the school is aware of the need for continued support in addressing the client's speech sound disorder. To address these gaps before the next review, it may be beneficial to continue targeted intervention with visual cues and other evidence-based strategies, increase opportunities for spontaneous speech generalization, collaborate with the school to ensure consistent reinforcement, and consider adding additional assessment tools or measures to better track progress and identify potential areas for improvement. Design an 8-week therapy block targeting spontaneous R generalization with different exercises that progress each week. To design an 8-week therapy block, I'll follow a structured approach based on the provided excerpts and recent conversational context. We've already established goals for producing R in initial word position and improving conversational intelligibility. We can focus on designing exercises that progress each week to support spontaneous generalization. Weeks 1 to 2, Introduction to R Generalization. Exercise 1, R Word Bingo. Exercise 2, Rhyming Games. Weeks 3 to 4, Gradual Release of Visual Cues. Exercise 1, Storytelling. Exercise 2, Reading Aloud. Weeks 5 to 6, Spontaneous Production Encouragement. Exercise 1, Role Playing. Exercise 2, Sentence Completion. Weeks 7 to 8, Generalization and Maintenance. Exercise 1, Conversational Games. Exercise 2, Literacy-based activities. Draft to progress update for the parent summarizing progress made, current focus, next goals, plan to achieve those goals, and 10 examples of practical home exercises for reinforcement. I'm pleased to share with you your child's progress in speech therapy over the past 9 months. As we approach our next review, I would like to highlight the progress made and outline our current focus and goals. Your child has shown significant improvement in producing the S sound, achieving above 80% accuracy in structured tasks. They've also demonstrated improved intelligibility in conversation, with peers and teachers noticing a reduction in frustration during group setting. Our current focus is on improving your child's ability to produce the R sound in spontaneous speech. While they have made progress in producing R in initial word position, we still need to work on generalizing the skill to more complex tasks and conversations. Our next goals are to achieve 80% accuracy in producing the R in initial word position across all contexts, to demonstrate improved conversational intelligibility with a noticeable reduction in sound distortions during fast speech, to develop strategies for self-monitoring and self-correction of speech errors. Our plan to achieve the goals: to support your child's progress, we'll continue to work on the following exercises: R word bingo, rhyming games using words that start with R, sentence level structure practice, gradual release of visual cues and support. To reinforce your child's learning at home, please try the following exercises: play a rhyming game, practice producing R in initial word position using flashcards or pictures, have your child practice self-monitoring and self-correction by recording themselves, engage your child in conversation that incorporate words starting with R, use visual aids such as pictures or videos, practice tongue placement exercises, engage your child in games that involve repetition, use books or stories that incorporate words starting with R, practice producing sentences with R in different positions, encourage your child to imitate and produce words starting with R in a mirror. So this is bringing together all the information that we've established. This is what a clinical workspace might look like in Docura. I can synthesize assessments, analyze progress, design structured intervention blocks, and communicate clearly with parents, all locally in an isolated workspace. That's how I'd use Docura in practice. To start a free trial or to learn more, visit docuraai.com.